Morning, everyone. My name is Nadia Hussein, and I'm the Maternal Justice Campaign Director at Moms Rising. On behalf of my organization, I'm very proud to support First Lady Tammy Murphy's Nurture NJ campaign, which takes important steps towards preventing and reducing maternal deaths in New Jersey. New Jersey has one of the worst maternal mortality rates in the country, and it's especially acute for Black women. Within the first year of giving birth, Black women in New Jersey die at 45, Within the first year of giving birth, Black women in New Jersey are 5 times more likely to die from maternity-related complications. Black women constitute 47% of maternal deaths, even though they make up less than 13% of the state's population. And Black infants are more than 3 times as likely to die than white infants. This is absolutely unacceptable. These racial disparities in maternal and infant deaths are largely the result of implicit biases in our healthcare system. Implicit bias is pervasive, pernicious, and deadly. Consider the story of Tiffany Douglas, a Black woman, a New Jersey mother, and Moms Rising member who suffered from preventable complications following a C-section. After Tiffany delivered via C-section, she knew she didn't feel right. She voiced her concern to medical staff, time and time again, but they told her that she was fine and discharged her from the hospital. But soon after she returned home, she broke into chills and a high fever. Fearing for her life, she called her mom, who lived far away, to come pick up her children while she went back to the hospital, where doctors found out that an infection had set in from her C-section. Fortunately, Tiffany made a full recovery, but many others, such as Sergeant Tamisha Dickey, who passed away in January 7, 2018, did not. Implicit bias means medical staff are ignoring the pain of Black women like Tiffany and Tamisha. And the result is not only a lower quality of care across the board, it is also leading to preventable deaths that leave motherless children, distraught families, and devastated communities in their wake. We need medical staff and our leaders to listen to Black women and mothers. We need better access to quality and preventative health care, and the First Lady's Nurture New Jersey campaign will help do just that. The campaign's focus on raising awareness of the factors driving racial disparities and providing the resources and tools necessary to combat maternal deaths will ensure New Jersey is healthier for mothers and their children. I want to thank the First Lady for her commitment to this critical issue and look forward to continuing our work together in the future. And now, it's my honor to introduce First Lady Tammy Murphy to speak more about why this issue is so close to her heart and what the Nurture NJ campaign will do for mothers, children, and families across our state.
So good morning, everyone. It is really a tremendous pleasure to be here with all of you today, and I thank you all for joining us. Thank you, Nadia, of course, for that introduction and for sharing some of our initiatives. I also really thank you for all that you do for mothers here in New Jersey. Your advocacy is really, really required, and you do a great job. Thank you to Cooper University Medical Center for hosting us all today, and for each of you, your being here. Today on Maternal Health Awareness Day, we honor the mothers like Tiffany Douglas from Newark, who bravely shared her story with us through Moms Rising, of pregnancy complications that went unheard. Also, Tamisha Dickey, who Nadia just recounted, who was a sergeant in East Orange Police Department, who died suddenly last year due to childbirth-related causes. You all may recall her partner's video that went viral of his singing and dancing with their newborn baby. So that was really heartbreaking. I also would like to honor Tara Hansen. She lost her life in 2011 due to pregnancy complications just 6 days after her young son, Brandon, was born. I have had the pleasure of meeting Brandon's dad, Ryan Hansen, who is here with us today. Ryan started the Tara Hansen Foundation and has done a lot to raise awareness on this topic, so thanks so much for being here, Ryan. I'm here with several esteemed members of the cabinet, my friends and partners. We have, where are you all? Okay, we've got Sharif El-Nahal, who is the Health Commissioner. We have Human Services Commissioner Carol Johnson over here. We have Children and Families Commissioner Christine Norbert-Beyer over here, and Treasurer Elizabeth Mayer-Moyo on the end. Everyone's here today to ensure that Tara, Tiffany, Tamisha, and many other mothers who have been lost or their voices have not been heard. I'm looking forward to, and everyone here, is to ensuring that more and more women here in New Jersey not only live through pregnancy, but live through the first year of that child's life. So as a mother of 4, I can clearly remember the joy in my heart when I first held each of Josh, Emma, Charlie, and Sam. So we have to make sure that every mother here has that same opportunity. In New Jersey, unfortunately, we all know that too many mothers cannot experience that. Despite our incredible innovative healthcare network, highlighted by institutions like Cooper, and our history of leadership in healthcare and the promotion of smart public health policy, New Jersey currently ranks 45th out of 50 states in the nation for maternal deaths. That means that 37 women die on average for every 100,000 births here in New Jersey versus 20 on a national level. For mothers and babies of color, as Nadia has mentioned, the statistics are even more dire. Within the first year of giving birth, Black women in New Jersey are more than 5 times likely to die than their white counterparts. And similarly, even though New Jersey's overall infant mortality rate is the lowest in the nation, among the lowest, Black babies here in New Jersey are 3 times as likely to die as white babies. So that happens in the first 365 days of their lives. This is, without a doubt, the widest racial disparity in the United States of America, and it is obviously unacceptable. For far too long, the stories of these Black mothers and infants have been neglected. Over the past year, I have met with stakeholders across New Jersey to understand the current condition of maternal and infant health in our state, and we've run the gamut, from nurses and doulas to philanthropic organizations and nonprofits. We want to tackle this crisis. We've also worked with the cabinet and together with legislators, Verlina, Gabby, Joanne, I think is here, Pam, Herb, Carol, Bill, here today, as well as the entire Black Caucus and the incomparable leader from our federal delegation on maternal and infant care, Congresswoman Bonnie Watson-Coleman. From symposia across the state to the Black Maternal and Infant Health Leadership Summit we convened in Drumthwacket, to an incredible $38 million in federal child care grants, to statewide community-based initiatives dedicated to improving services and access to perinatal care, we have been working every angle of maternal and infant health to make sure that we are stronger, fairer, and healthier New Jersey. But all this great work will only be successful if we can ensure that our families know what is available. It is up to us to meet the families where they are. That is why today, on Maternal Health Awareness Day, we are excited to announce Nurture New Jersey here, a new statewide awareness campaign that pledges our commitment to every mother, every baby, and every family to reduce infant and maternal mortality and morbidity and eliminate racial disparities. The Nurture New Jersey campaign will encompass all the efforts that my office and the administration have already taken, as well as those efforts we will take to improve maternal and infant health outcomes. This includes greater collaboration between departments to ensure that when a mother or father enters one of our facilities, we are providing the most targeted and comprehensive care possible. Our departments have programs that touch upon so many aspects of infant and maternal health, not just access to quality health care, but access to transportation, to childcare, to paid family leave, and much more. And collaboration is needed so that mothers and babies who require services from multiple departments are getting the best and most comprehensive care and resources that we can possibly provide. And I'm also proud to announce that our third family festival, I saw Arturo Brito here somewhere, Arturo Brito of the Nicholson Foundation, works in partnership with us, and they have funded 2 of our 3 family festivals, and the third one is coming up, so thank you, Arturo. I'm really happy to announce that our next one is going to be here in Camden on March 2nd at the Octavius V. Cato Community Family School. The Family Festival, like the prior ones in Patterson and Trenton, will connect mothers, fathers, grandparents, and anyone involved in childcare with state, county, and local resources. Essentially, the Family Festival is a one-stop shop for breaking down barriers for families seeking resources and care. It really does take a village to raise a child, and in New Jersey, we are intent on making that village very strong. We're committed to ensuring that we can nurture the lives of every mom, every baby, and every family in New Jersey. Thus, there is no mystery in the naming of our new statewide awareness campaign, Nurture New Jersey. It's now my pleasure to introduce the Commissioner of the New Jersey Health Department, Dr. Sharif El-Nahal. Thank you.
Thank you very much to the First Lady, first and foremost, for convening not only our cabinet departments, but such an incredible group of stakeholders that extends from advocates to hospital leaders and so many who have done really great work in just the first year in maternal and infant health. I want to thank in particular the New Jersey legislative leaders as well who are here today and who have prioritized this issue. With all of our efforts, I think we will be able to make incredible progress. Maternal Health Awareness Day is time for our partners to pledge to advance healthcare quality for all mothers and babies in our state. And the First Lady's Nurture NJ campaign does just that. As the First Lady explained, New Jersey mothers are dying from pregnancy-related complications at alarming rates, and that needs to change. I want to highlight this by going through a case, a 27-year-old woman who delivered her second child in New Jersey and very sadly was only able to spend a mere 5 days with her newborn. This woman's labor was induced at 41 weeks. When she entered the hospital, her medical team did not note any problems. After 4 hours of active labor, she became exhausted, and her baby was delivered using forceps. During the delivery, she suffered an extensive tear. Records show that the mother's pulse was elevated, but the only advice she received was to keep the area clean and take warm showers. On day 2, she was still in pain with an elevated pulse, and blood tests showed signs of possible infection. But despite those symptoms, she was discharged home. On the 3rd day, this mother continued to feel increasing pain at home. She called her doctor, who gave her an appointment the next day. When she got to the obstetrician's office, her doctor told her husband to take her to the emergency room immediately. But by that time, it was too late. Her health continued deteriorating, and she passed away. The cause of her death was a condition called necrotizing fasciitis, a rare and very serious bacterial infection. She only spent 5 days in pain with a baby that she carried for 9 months. Our thoughts are with these families as we seek to bring them justice through our work. You don't have to be a doctor or a healthcare worker to understand that there were many missed opportunities to help this mother. There are many lessons to learn from her story, but the most important one is that our systems of care are not strong enough to help clinicians prevent complications or catch them early enough to prevent tragic outcomes like this. This is not the fault of individual doctors, nurses, or hospital leaders. Until now, the state has yet to make it a priority for quality improvement. Under the First Lady's leadership, that is now changing under the Nurture NJ campaign. This morning, just before this conference, we had a very productive meeting with our key partners, including many of you in this room, to discuss our administration's approach to tackling this in a unified way. I want to cede some of my time to Dr. Adrian Kirby, CEO, our host and CEO of Cooper Medical Center. A lot of folks know that Camden has among the worst public health morbidities and risks to its residents in the state. With all of that said, the C-section rate is lower than the state average and the national average here in this hospital. Dr. Kirby will explain how.
Good morning, and on behalf of the entire team here at Cooper, welcome. We're so happy to be able to sponsor this. And I'd like to extend my personal thanks to the First Lady and to the Commissioner for their commitment to this very important initiative and really changing the lives of our families and our community. So Cooper has a very long legacy and a long history, over 130 years of serving the city of Camden. And, you know, it started with the flood of immigrants from Italian, Irish, Polish who came to this country at the turn of the century and settled in Camden and really depended on Cooper to take care of them, to the current day where we have a largely African American and Hispanic population. We know that there is nothing more relevant to the outcome of obstetric care than the social, cultural, and economic factors that influence people's lives. And even with these challenges, our clinical team here have been able to do the right thing and really hunker down, put policies in place, and drive the outcomes that they've achieved that we're talking about today. I'll tell you some of the lessons I've learned from our physicians, because believe me, if you ask me exactly what happened, I may not be able to tell you, even though I did start my career as a labor and delivery nurse way back in the 70s. But if you think about what we've done here, as I talk to our physicians, they talk about three main things. First of all, it's a complex issue. This is the only population where you're caring for two patients at one time, and where the interests of those patients are sometimes not the same, where you have to worry about the outcome for one patient, the baby or the mother, and the things that you need to do may not be the same. So it is a very complex issue, and it's a very complex situation. The leadership that's required is the number one thing that will drive change. Not only physician leadership, but nursing leadership and involvement of the family as advocates for the patient. The second thing is really, as I said, to recognize the social and economic factors that influence outcome and do what we can. And earlier today we heard from other health systems who talked about many of the things that they had taken on to do that, and we too at Cooper have done that as well. And then I think probably the most important thing, and it seems so simple, and Dr. Bingham talked about this today, is make it personal. Is this the care you'd want your own daughter to have? Is this the care you'd want your own grandchild to have? I can't speak about myself anymore. I'm in the grandparent phase. So, you know, if you really make it personal and look at the individual as a member of a family and important to so many people, I think we will deliver care differently. So I'm going to close just by saying I speak on behalf of everyone at Cooper who has been so dedicated to this effort, and everyone, all of my healthcare leader colleagues across the state who have been here today, to say that we are fully committed, we support the First Lady's efforts, and we're going to do everything we can to change the statistics in New Jersey. Thank you.
So you just heard from Dr. Kirby about how one hospital system can do everything it can to make progress in this issue. We just left a meeting where we had hospital system CEOs and hospital leaders from across the state all unanimously commit to the following broad goals. The first, reducing maternal mortality. The second, reducing maternal morbidity or complications that can lead to death, including C-sections. And the third is to reduce disparities, the glaring disparities that we're seeing in terms of, in particular, Black women compared to the general population in maternal health and infant outcomes. That was a unanimous commitment for all of these goals. And with the help of Dr. Bingham, who led efforts in California to reduce the maternal mortality rate by over 50% in a matter of 5 years, we will be coming out with a strategic plan later this year that will provide the timelines, the metrics, and the shared goals that we have with our colleagues in the hospital system. Thank you very much for your time. I very much appreciate it, and we will be able to get there together. Thank you.
Thank you, Dr. Kirby, and thank you, Sharif. It is now my pleasure to introduce the Commissioner of Human Services, Carol Johnson.
Good morning, everyone. I join with others in thanking Cooper for hosting us today, and especially thanking the legislative leaders who are here with us, who we are happy to stand beside and work together with on this critical issue. The First Lady has really been the catalyst to bring together folks from across the cabinet to really stand up and say these are unacceptable rates of disparities in our state, and we need to change the tide on this issue. And so while there are a couple of representatives of the cabinet here today, we stand in the shoes of the whole cabinet, because while I am the Commissioner of the Department of Human Services, and that gives me the opportunity to bring our Medicaid program, our food assistance program, our emergency assistance program to the table to help on this issue. The First Lady has brought transportation and agriculture and housing and the people who can really help us extend our reach to all of those critical social determinants of health that really address the economic and social issues that our colleague has raised. So we're honored to be here. We're honored to be part of the Nurture NJ campaign. And just to say a few things about the things we've done in the Department of Human Services to address these issues over the last year, and that we'll continue to do as we lean in going forward on these issues. Over the last year, we have, with the help of the legislature, expanded family planning benefits under Governor Murphy's leadership to for women up to 200% of the federal poverty level. That is a significant opportunity to give women more choices and options when it comes to their own family planning. We've also, through an administrative order, expanded coverage for long-acting reversible contraception, which the CDC tells us is one of the most effective forms of contraception. We've made LARCs available in the postpartum setting, which again, clinicians tell us is one of the most effective times to help have that conversation about family planning choices. We've also been able to expand Medicaid benefits to address critical risk issues like tobacco use and diabetes. So we've expanded access to tobacco cessation services in Medicaid, and we've created new diabetes prevention programs for the purpose of ensuring that we can reach people earlier and help prevent the risks, and in this instance, that can cause complications and morbidity in pregnancy. We also, as the First Lady mentioned, have been able to significantly expand our capacity when it comes to supporting child care services in our state. Lower and moderate income families who qualify for our programs have been getting child care subsidies for years, but it's been probably about a decade since we've been able to increase substantially the rates for child care services. And so we were delighted to be able to do a $38 million investment this year in expanding access to child care. And as those of you in this room know, if your children are in child care at this moment, it is very hard to be at your job and do well and succeed and to get on the right economic footing if you aren't confident in the fact that your children are in safe and secure child care. And so we know child care is an important part of this overall equation. So we're delighted to be part of the Nurture New Jersey campaign, and we're delighted to stand together with you as we fight this fight together.
Thank you, Carol. It is now my pleasure to introduce the Commissioner of Children and Families. We've got Christine Norbert-Beyer. Thank you.
Good morning. It's my distinct pleasure to join First Lady Tammy Murphy, my colleagues from state government, and all of our state partners assembled today to recognize Maternal Health Awareness Day and to kick off the Nurture New Jersey campaign to improve maternal and infant health in the Garden State. At DCF, we're dedicated to making sure that all New Jersey residents have an opportunity to be safe, healthy, and connected. And we understand that safe infants and healthy families first begin with safe, healthy mothers. At DCF, we offer a multifaceted continuum of services around maternal and early childhood health, which runs the gamut from prenatal counseling, parental planning for safe delivery, and post-delivery supports for mom and baby that extends through the child's 5th birthday. Independently within DCF and through partnerships with other state departments, we have established a statewide network of early intervention and prevention services, central intake hubs, evidence-based home visiting programs, federally mandated plans of safe care, and family success centers. Central intake hubs guide pregnant women and their families to the services and supports that are available in their own communities. These county-level hubs provide a vital linkage between programs and eligible participants, connecting new parents with the supports and local services that promote child and family wellness with consideration to the language needs and cultural competencies. Home visiting is an evidence-based prevention strategy for delivering services, education, and referrals to improve maternal and child health directly to families within their own homes. Through the home visiting programs, nurses, social workers, early childhood educators, and other professionals provide support in the homes of families who participate on a voluntary basis. In 2018, across all 21 counties in New Jersey, 7,000 families received evidence-based home visiting services over the course of more than 73,500 home visits. This includes services to more than 5,000 children birth to age 5. About 1,400 mothers were screened for depression, and 74% of mothers who received services for home visiting attended a postpartum care appointment. Plans of safe care aid mothers and mothers-to-be who are substance dependent or substance users make plans for the safety and well-being of their child prior to and after delivery. New Jersey DCF has a model implementation of the plans of safe care to establish a framework through which mothers will have access to recovery, treatment, and support while ensuring their baby is safe. The common thread through all of the DCF services indicated here is that they're provided early, protect women and infants, and promote positive outcomes, all to prevent tragedy. These are just a few of the areas where DCF is contributing to better services and improved outcomes in the areas of maternal and childhood health. And while there's certainly more that can be done, in particular, initiatives like universal home visiting would vastly expand our reach and help reduce racial and economic disparities around access to services, I'm encouraged that we have leaders such as the First Lady who recognize just what's at stake. Certainly, we have work to do, but we have a strong foundation of services currently available and a willingness to tackle the issues of maternal and early childhood health when well-being head-on. I'm encouraged about what comes next. Working together with the leaders up here and with all of you, we can make a difference and make sure every mother, every child, and every family in the Garden State is nurtured and supported. Thank you.
Thank you, Christine. And it is now my pleasure to introduce a leader in the Assembly who's been working on the infant and maternal mortality, and someone with whom I worked personally on the Trenton Family Festival, Assemblywoman Verlena Reynolds-Jackson. Thank you.
Good morning, everyone. I'm glad to be here today, and I want to thank the First Lady, the Cabinet, my colleagues that are here, and each and every one of you. We're here today to discuss infant mortality health that are affecting women and children across New Jersey, particularly African American women. So thank you to all the hospital systems that are here to collaborate on this. Women all across New Jersey deserve better. More mothers are lost due to complications during and after pregnancy, most of which are preventable. Black women today are 3 to 4 times more likely to die during pregnancy or delivery than a white woman. Before we blame lack of access to health care or lack of access to education or low income, a wealthy black woman with advanced degrees will still be more likely to die than a low-income white woman. This is a human health crisis. This affects future generations. We in the Assembly are committed with you to doing whatever it takes to address these concerns and to make maternal health a top priority. That's why I'm proud to be a sponsor of one of the 14 legislative measures my colleagues and I introduced to strengthen maternal health care in New Jersey and begin saving mothers, babies, and families. Those bills were approved by a joint committee yesterday. It's time again for reproductive justice for women and our babies. It's time again to work towards strengthening preventative and supportive health care for mothers before and after birth. It's time to restore the beginning of motherhood as a special time for a motherhood for her and her baby. I thank you, First Lady, for introducing the Nurture New Jersey, and I look forward to working with each and every one of you. Thank you so much.
And thank you, Verlina. So I finally come to our last speaker, who perhaps could be our poster child, given what we're talking about right now. I'd like to introduce the chair of the Assembly's Women and Children Committee, Assemblywoman Gabby Mascara. Gabby?
Good morning. First, I would like to thank First Lady Murphy for inviting me here today. Thank you for your advocacy on this very important issue. As it was mentioned before, today is Maternal Health Awareness Day, and it is so fitting that we are here at Cooper Hospital. I applaud Cooper for leading the way in the maternal fetal medicine, having established this specific program over 30 years ago, first of its kind in South Jersey. Now Cooper sees over more than 20,000 patients per year in the surrounding area dealing with just this specific area of maternal fetal medicine. So thank you, Cooper, for doing that. Sadly, though, even though with despite the medical and scientific advancements, New Jersey and our nation are still seeing a rise in death related to complications from a pregnancy or childbirth. We must do better. Just over a year ago, I was selected to serve as chair of Assembly Women and Children's Committee, and I made maternal health a top priority. At the direction of Speaker Coughlin and Majority Leader Greenwald, one of the first topics we addressed in committee was maternal health. Last March, when we had an opportunity to pass some existing bills, I promised that it would only be the beginning of the conversation to address maternal health. Later in 2018, my colleagues, Assemblywoman Reynolds Jackson and members of the Black Caucus, convened a joint committee on racial disparities in prenatal services and infant mortality. It cannot be said enough, and I think the Assemblywoman mentioned it in her remarks, but it has to be said how sad these numbers are, that of the maternal deaths in New Jersey, nearly half, 46.5%, are African-American mothers, almost 14 are Latina mothers. When combining these numbers, ladies and gentlemen, that's over 60% of maternal death in New Jersey that are women of color. This is unacceptable. After speaking with countless professionals and understanding the disparity of prenatal care, I knew it was time to look at alternatives. That is why in December, the Women and Children's Committee hosted a hearing on doulas and the role that they play in a community, especially for women that are expecting their first child or their second child. From that hearing, we learned a lot. Just yesterday, I had an opportunity to co-chair a joint committee of Women and Children in Health, where we approved 14 bills that really moved New Jersey forward in the maternal health field. I look forward to working with the First Lady and Governor Murphy in support of these bills. And these package of bills are very important. They give women a voice. They use evidence-based solutions. They help develop protocols and guidelines for doctors and hospitals, insurance companies, as well as provides transparency and education. I am proud that Speaker Coughlin made it a priority to move these bills to combat these issues. On a personal note, if you can indulge me, my husband and I are expecting our second child, so this issue really speaks to me. I generally understand the level of urgency of improving access for all mothers across our state. We can no longer sit idly by. Together, and not only together, and it was mentioned before in the remarks that it does take a village, and I do believe that. It takes a village, that we can fix this, we can do something, so let's do it together. Thank you.
I just want to reiterate one thing from earlier today. Dr. Bingham, who I'm not sure if she is still here, but Dr. Bingham said earlier that we should make the goal in New Jersey to be the safest place in the world to deliver a baby. I love that goal. That's a great goal. So I think that we can do this if we all band together. We had as Dr. Helen said earlier, we have had an incredible stakeholder meeting earlier, and we are all committed to working together, and I think at the end of the day, that is what it's going to take. This concludes our speeches today. I think that Alex, you tell me, I think we're going to take a couple of questions, but thank you for staying for the formal remarks.
Hi. So could you be more specific about what the campaign here in New Jersey will be? Is there money attached to it? And what kind of concrete goals set?
Okay, so first of all, I will tell you we are lean and mean, and we do have our treasurer standing over here, but you should not take anything from that. But we have a lot of great partners. I already mentioned we have the Nicholson Foundation who is helping us, and Dr. Ellen Hall can also address that from his standpoint, as well as Carol, I think, already talked a little bit about that from federal funds. We will be very careful, I promise you, and most of what we are doing is going to be collaborative, and it's going to rely on our all coming together, both inside the government as well as outside. We will plan to have everything from more meetings internally, at least for a year. We are also going to have more family festivals. We're trying to have 5 of those a year. Thank you, Arturo. We are going to have a big social media campaign. We're going to do op-eds. We are going to have each person on the cabinet who's involved in this project is going to be working and having Twitter feeds and things like that. So there's a lot of social media around this. I know I'm forgetting a couple things. I apologize, but we have a whole list. We can give that to you later. Yeah.
One follow-up. Someone was saying, don't believe that this is just about socioeconomic status, that, educated, affluent Black women are still at risk. Could someone there describe why that's so? Is there some breakdown between physicians and their patients? Or is it cultural on some level?
I'm going to say one thing: systemic racism. I'm going to now pass the baton and let Dr. Ellen Hall tell you more about that, but from my vantage point, systemic racism.
I would say not much color to add beyond that, other than to add a little bit of a scientific twist and say there's a concept called implicit bias, where even clinicians of color tend not to necessarily treat patients of color in the same way. This has been proven in study after study. And so what this requires is an unprecedented look about how we can tackle implicit bias at the point of care, and that requires leaders in hospitals, clinics, and institutions, in addition to the state, to make this a priority. In medical school, I did not get training in implicit bias, and that is the case in most, unfortunately, institutions across the country. We want to change that here in New Jersey, and it's going to be absolutely critical to do that. I don't know, Carol, if you had any other thoughts.
I'll just add, as important as it is in the clinical setting, there is research on the impact of toxic stress of living with racism throughout your life and what that can mean on the health and well-being of women. And so we too often, I think, in the advocacy and policy world, sort of create a list of here's the things women could do if we, got the message to them. And in fact, what we need to do is change the system and the services and the way we speak and outreach to women so that they interact in a positive way with both our services and our healthcare delivery, and that we get the best possible outcomes.
Okay, I think we'll be there and then here. Yeah.
To anybody on the panel, my series of comments really struck a nerve in terms of it's one thing to admit to systemic racism, implicit bias. It's another thing to actually do something about it. So how do you go from point A to point B, I guess is what I'm asking. How do you get to addressing these issues rather than just talking?
Does anybody want to? This is back to what you were saying earlier. Yeah.
So the first way to do it, I would say, is teaching best practices in clinical care. That concept is to apply the same approach, the same protocol, to every patient regardless of the color of their skin. So having people trained in the right thing to do clinically when complications arise is important. And then on top of that explicit training on how to avoid and recognize in ourselves as doctors, nurses, and other folks that see patients when these biases are coming into play. And so part of what we're going to be doing with the protocols that we ask the hospitals to implement is addressing this head on.
Also, I just want to add, when we started this effort, there were 2 commissioners involved. There are now 12. And we've now realized that this is not just what we all thought, which is lack of prenatal care. This is transportation. This is access to insurance. This is access to food. I mean, it's education. It's a lot of things coming together. Anyway, yes. 45th, but we'll take 45. I'm going to speak from my own vantage point. Over the last year, having traveled around the state, I think that there are some great people, great organizations who are working on this topic, but we've all worked in silos. And I think that the big challenge is bringing everybody together and working together to try and figure out what the actual solutions are to these challenges. We certainly have the know-how in our state. We just have to figure out how we're going to execute on that. And I know that we believe that 50 to 60% of this crisis can be eliminated just by putting in protocols and handling these patients in a more comprehensive way. Cesareans? Do you want to? I mean, you should come again. This is your area.
No problem. Thanks, First Lady. So this is not an easy thing to tackle, but the good news is that we have states and models that have already worked that we can try to adapt to New Jersey. So there's a set of complications that are the most common causes of maternal deaths. And we know that over 50% is the first clots, and that you have a list, and we have protocols to not only address those complications faster if they arise, but also to prevent them from happening in the first place. So that's the approach that worked in California. We'll be doing some version of that here. And then, of course, my colleagues on the cabinet will be working through their purviews for a coordinated strategy.
And I'll just add that it's not just about hospitals, right? We need to make sure that there's that set of community services so that further upstream, people live in affordable housing, have access to food and nutrition, are able to support the kind of healthy lifestyles that would ensure the best possible health outcomes. And that's why you hear so many folks in this room talking about, in the healthcare sector, talking about their work they're doing in social services, because we need to have both pieces of that equation together.
Okay, one last question. Yes, please.
First, I want to offer my condolences.
Thank you.
And then I actually have a small topic question. I was just wondering if you plan to campaign for Democrats outside of the state.
Do you know what? That is, I really want to stay focused on what we're talking about here today, so apologies. Thank you, my sister. I appreciate that. Okay, I think that's it. I really appreciate everyone being here today and look forward to working with everyone here as we go forward.